Pain following an operation can be expected and even considered normal. However, when postoperative pain is not managed appropriately, it can have a number of negative consequences, including increased length of stay, reduced quality of life, prolonged opioid use, and adverse effects related to opioid use, as well as the progression of acute pain to chronic pain. Accurate pain assessment is important in order to manage postoperative pain and prevent, reduce, or eradicate the complications associated with prolonged uncontrolled pain. Postoperative pain, as mentioned previously, is a relatively normal experience. Approximately 75% of people who undergo surgery experience acute postoperative pain. However, due to poorly managed acute pain following a procedure, 2 to 10% of people worldwide end up developing chronic or persistent postoperative pain. This pain can be classified as chronic when it exceeds a duration of over 3 months. Chronic pain is the third most costly health burden in Australia, being the primary cause of increased length of stay. It affects 1 in 5 Australians, including children and adolescents, with 50 to 80% of people experiencing chronic pain having ineffective or inadequate treatment/management. In order to manage and control postoperative pain, we need to understand the extent of pain that is felt. Pain is subjective, and there are many factors that influence the way that pain is experienced by the patient, including pain tolerance and pain threshold. To effectively understand the amount and severity of pain a person is experiencing, we need to be able to assess the pain. This can be achieved with a number of pain assessment tools that are available to us, including numerical scales, PQRST, visual pain scales, and more recently, ANI. A numerical pain scale is the most commonly used method of pain assessment in the clinical environment. Patients are asked to rate their pain from a scale of 0 to 10, 0 being no pain at all and 10 being the most excruciating pain imaginable. The numerical rating scale is a useful tool in interpreting the severity of pain. However, it fails to go into depth about any other detail related to pain. This tool should be used in conjunction with other assessment tools such as the PQRST model to gather more information that may be required to adequately manage the pain. The pain scale is also limited due to the fact that the patient needs to be able to understand and voice their pain in order to be assessed properly. This pain scale cannot be applied to nonverbal individuals, infants, unconscious patients, etc. Due to its limitations, the numerical pain scale should never be used alone unless the patient states they are experiencing no pain at all. Probing questions or additional pain assessment tools should be used in conjunction in order to manage the pain accordingly. The Visual Analog Scale, VAS, is a useful tool in the assessment of acute postoperative pain. Similar to the numerical scale, it requires a patient to rate their pain from a scale of 0 to 10 with the visual aid of facial expressions pictured. This assessment tool is more effective than the MPS as it is more universal and can be used with a wider range of people, including non-English speaking background, communication deficit, and young children. The facial expressions of the patient can also be cross-checked with the pictures, creating some objective data in the pain assessment. Although the VAS can be used with a variety of people, it is still limited to conscious patients and only determines the severity of pain. It should never be used alone, utilizing probing questions or other assessment tools to gather a detailed understanding of the pain being experienced. The Analgesia Nociception Index, ANI, is a relatively new development in the assessment of postoperative pain. ANI is an assessment conducted by monitoring the heart rate of variability in the postoperative period. It is an attempt at creating an objective measurement of pain for situations where subjective pain scores may not be applicable, e.g. in unconscious or sedated patients. Whilst this concept would be useful in situations where verbal communication is unavailable, research has shown that whilst ANI can determine that a patient is in pain, it cannot yet differentiate between mild and severe pain. Therefore, the degree of management required cannot be determined. Now that we have appropriately assessed the pain, we can begin to manage it accordingly. There are a number of methods that can be used to manage postoperative pain, including a multimodal approach to analgesia and non-pharmacological interventions. A multimodal approach to analgesia involves the use of different analgesics in combination with opioids. This is effective in the reduction of post-operative pain whilst minimizing the adverse effects related to opioid use in opioid-only regimens. Studies show that the combination of opioids and adjunct medications, including NSAIDs and paracetamol, are associated with lower pain scores, reduced number of readmissions, and length of stay in hospital, both in opioid tolerance and opioid-naive patients. Transcutaneous electrical nerve stimulation, TENS, is a non-pharmacological therapy that works by transmitting low-voltage electrical impulses at the site of pain. This reduces the ability of the brain to interpret the pain signals, therefore reducing the pain experienced by the patient. The TENS machine can be used alone as a more holistic approach to pain management or in conjunction with modern pharmacological analgesia for the most effective pain management. Cognitive behavioral therapy, CBT, is a psychological approach that has been proven to effectively reduce the post-operative pain and chronic pain related to unmanaged prolonged post-operative pain. CBT can consist of medication, mindful practice, etc. CBT assists in reducing psychological stress. Pain causes stress, therefore CBT works to reduce the stress caused by painful stimulation. Hence, the effectiveness of CBT on the reduction of pain intensity. Although these methods of pain assessment and management may be beneficial in the recovery of post-operative patients, there are barriers that may affect the implication into action. Some of the interventions, including the ANI and TENS machines, can be costly. The hospital may lack the resources to fund the machines or may have a limited number of machines available. Additionally, healthcare professionals may lack the knowledge to use these machines, as well as implementing strategies such as CBT. Another barrier to implementation of these therapies may be the culture between staff. Negative culture may prevent the implementation of new evidence-based practice, e.g. multimodal analgesia rather than opioid-only regimens. Stigma within cultures regarding the expression of pain can also be a barrier to adequately assessing pain, therefore reducing the effectiveness of pain management provided. In order to overcome barriers, healthcare professionals need to provide a positive and supportive culture where new evidence-based practice can be implemented with the support of all staff members. Positive culture can help to reduce cultural stigma around pain and asking for pain relief. Additionally, educational in-services and additional training should be provided to the staff members can correctly use equipment such as the ANI and TENS machines and provide information regarding CBT to the patient and or assist with the implementation of CBT alongside pharmacological interventions. While some of the interventions mentioned still require additional research, utilizing assessment methods such as the numerical pain scale and visual analog scale in people who cannot verbalize their pain, along with probing questions such as the PQRST model, is appropriate in identifying each aspect of pain. The use of multimodal analgesia is a widely accepted best practice in order to reduce adverse effects of opioid-only intervention. Utilizing non-pharmacological interventions also assists with the reduction of adverse effects related to opioid use and effective pain management. In conclusion, effective post-operative pain assessment is required in order to adequately identify the amount of pain a patient is in so that healthcare professionals can appropriately manage their pain. This can be achieved through the use of assessment tools, e.g. numerical pain scale, VAS, PQRST, and so on. A multimodal approach to analgesia in conjunction with CBT and TENS therapy can appropriately manage post-operative pain, increasing rate of recovery and reducing length of stay in hospital, along with the number of consequences associated with unmanaged pain.